Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, over the last 2 days, we've had the second round of vaccinations for staff and residents who had received their initial dose right before Christmas. We've also had staff and residents receive their first dose. How is the process going, and have you come across any concerns?
Well, Sandy, it's hard to believe that we're already at the second round of vaccine distribution. It seemed like yesterday that we were preparing and giving presentations about the vaccine just being approved. So I think it's amazing that it's gone as well as it has, as quickly as it has. From my perspective, I was lucky enough to get the second Pfizer vaccine on Monday, and this time I got it in the outpatient clinic at MHC. And I have to say it was a very smooth process. And I'm just talking from me as an individual getting the vaccine and what I observed. But my appointment was 11:30 in the morning, and I stood on line. It really wasn't a very long line, and the spirits were really good. People were upbeat and laughing and talking to each other. I think I got through, within 10-15 minutes. So everything went, really well and according to the schedule. I haven't heard of any significant issues with regard to the vaccine. And, the interesting thing is the population that we administer the vaccine to are the frailest of the frail, are very frail elderly people. Many are over 90 years old with multiple comorbidities, cardiac disease, renal disease, pulmonary disease, and they've all tolerated it very well. So I think that speaks a lot to the safety and the process that's been going on. So over the time as we've talked, I belong to the coronavirus task force, and one of the things that I do as a member of that task force is I'm reviewing cases, individuals that had previously had medical exemptions, residents in the nursing facility and so forth, that really may not need an exemption based on CDC guidelines, and trying to get everybody immunized that is safe to get the vaccine. So, I think that, and the other thing I would just comment on is, the other committee we've talked about that I serve on as a subcommittee of this coronavirus task force, the Vaccine Distribution Committee. And I'm just going to show you, even though you probably won't see it, but there's so many parts and pieces to vaccine distribution throughout the continuum, and when you put that all together with who's going to get what vaccine and what dose, is it the first dose, the second dose, or whatever. So this committee helped develop a vaccine clinic calendar, which is on the internet. But I'll just show you quickly, but I refer to this, it kind of saves my life because it puts everything in such a nice organized framework. So I thank everybody for working together to put that together. So in closing for me, I try to come up with an inspirational quote. This one is actually from John Lennon, who said, "Everything will be okay in the end. If it's not okay, it's not the end." And the way I look at it is things are going to be okay. It's not the end for us yet. We're still moving along in our journey. We've given the second dose of vaccines according to schedule. And, I think we still have to be diligent, wearing masks, hand washing, social distancing, avoiding large crowds, and unfortunately, but probably most importantly, avoiding travel. And I think if we do adhere to this, in the end, everything will be okay. So thank you, and I enjoy talking with you.
Thank you, Dr. Schwartz, so much. We love having you, and we always look forward to your quotes because they're always spot on. And JP, as Dr. Schwartz said, our vaccinations schedule continues, and this week it's expanding to cover even more of our continuum. Can you tell us what the plan is at this point?
Yes, Sandy. First, I will say, and I want to echo what Dr. Schwartz said. One of the things for Masonicare is we were one of the first nursing home and assisted livings to get the vaccine. And The good news is we were the first. A little challenging was to work through the bugs and really have the ability to have the clinics and our care partner, which was CVS, really work through kind of the challenges that they had with the vaccinating so many people. And I will tell you, I was fortunate enough to get my second shot on Monday too. And same experience as Dr. Schwartz. It was very smooth, very quick. And it definitely, you could tell the difference of going through it the second time that our staff, CVS, all learned from their first experience of administering the vaccine, and they did an absolutely fantastic job. So the experience was very good, both on our healthcare center, but also at Masonicare at Asher Village. So I wanted to acknowledge the hard work of all the staff that have worked to put this together. And you could definitely see a change in how rapidly we were able to get the vaccine out the second time. With that being said, we have quite a few clinics over this coming month for all of our residential living communities that we service. So I'm extremely excited to be able to get it out all in the next few weeks. And, you know, I think when we talk about really this pandemic, this is the shining star. This is that flower that really will blossom. And, you know, I every day and Dr. Schwartz does this too. The Masonic Charity Foundation gives us a calendar, and it looks like this. And today, which is January 13th, if we could see the miracle of a single flower clearly, our whole life would change. The vaccine is that flower right now. And if everybody gets the vaccine, our whole life will change. We will go back to some normalcy. And then I think that if anybody really hears that, that's what it is truly about. This vaccine will give us the ability to see the light, to be able to change our life to a more normal life that I think we all are missing so much. And I will say this, the residents that are all getting ready for their vaccine, they are waiting. I would say patiently, but I would tell you they are very much saying, when is it coming? When is it coming? And I think they also see that this vaccine is that flower, is that miracle to help us move forward to the normalcy. So we're extremely excited to be part of it.
That's great, JP. Great news. And we are looking forward to speaking to one of our residents who has received the vaccine next week when we come to you with our update video. So that will be great.
Sandy, one little thing, if you don't mind me indulging too. I want to thank all of our residents and family members who have been so patient during not only our restrictions and us trying to do everything we can do to keep those that we are trusted to serve safe, but also thank them just for really being those cheerleaders, knowing that we are doing everything we can to keep them safe. And last, I want to thank all of our staff. They're our true heroes. That flag that's behind Dr. Schwartz right now is a thank you to all of our staff. Every day I'm truly amazed at everything that they do, even during the most stressful times. So I just wanted to circle back and say thank you to all of our staff for everything that they're doing.
Absolutely. Absolutely. I don't think there's enough ways to thank them. Well, and thank you both so much for sharing your time with us once again and all of this important information. And we appreciate you watching at home. Until we see you next time, we hope you'll stay safe and stay well.